I call this Thompson Board of Selectmen meeting to order, 6:30, virtual meeting, December 3rd, 2020. Would you all please rise for the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Patty, would you call the roll, please?
David Douglas.
I am here.
Marie Brilliant. Marie Brilliant.
I'm here.
I could see you, but I couldn't hear you. Ruth Lyons.
Here.
Matt Nixon.
Present.
And Roland Tufts.
Here.
All present.
Thank you, Patty. And town managers report.
Hey, good evening, everyone. I'd like to report Topsom recently just signed an agreement with Paint Care. It's a program that'll be offered at a solid waste facility. It'll ensure that, well, actually people can drop off any oil-based or latex paints to an attendant located at the facility in a big pallet. And once the pallet is full, Paint Care will come and haul it off free of charge. So this is a service that generally people took advantage of once a year over at Brunswick Public Works as a hazardous waste day. And paint was always a big portion of that. So we teamed up with Paint Care to allow this service to happen here in Topsom. So the program should start soon, and we're looking forward to it. The solid waste director would also like to remind everyone to plan ahead for the upcoming holiday when making trips to the solid waste facility. Due to the social distancing requirements and the increased waste disposal during the holiday period, we should expect wait times upwards around 30 minutes. So what he's trying to do is remind everybody to pre-sort your trash prior to arriving, expect delays, and wants to remind everyone also that Christmas wrapping paper is no longer recyclable. I'd like to report that this past August, the town was awarded a Keep Maine Healthy grant from DHHS at the state for COVID-19. We just closed that grant out. The town captured 99% of the grant, totaling $250,000. The grant reimbursed the town for COVID-19 related personnel costs, facility modification repairs, supplies, PPE, cleaning and sanitization equipment, and a new website redesign and communications upgrade. So we expect the website to be up and running hopefully within the next 3 months. And we're currently working with a graphic designer and content manager on this program right now. I'd like to report that Topsom was recognized by the United Way of Mid-Coast Maine for the level of contribution from our staff. Big thanks to our staff for helping the community. It was a big hit here, and special thanks to Rose Wood and Mark Waltz for getting this program restarted here in Topsom. If you haven't noticed, our tree next to the flagpoles in the memorial here at the municipal complex has been relighted. So please stop by when it gets dark and take a look. Our fire department and recreation department did a great job putting that up. And our public works department put wreaths around each of the each around the light posts down in Lower Village and also at the municipal complex. So nice job, and hopefully it brings some good Christmas spirit to everybody. The recreation director, as well as their fire, police, and rec department, it has invited Santa to come to Topsom on Saturday, December 12th. He'll be visiting neighborhoods and will be escorted by our fire and police departments. The map of his route is available at topsomparksrec.com, as well as the Facebook page for Parks and Rec Department. The snow date is scheduled for December 19th. So mark your dates for December, or your calendars for December 12th, and expect Santa to be coming through the area. And also the rec department is hosting Santa's Switchboard, which is now available for Topsom kindergarten and first graders. Parents can register their child for a call from Santa or Mrs. Claus by following the online link located on our Parks and Recs department website at topsomparksrec.com. And lastly, I'd like to thank Lois Skillings and Dr. Chris Bowie from Midcoast Hospital, who'll be providing a COVID-19 update tonight. And that's all I have. Thank you.
Thank you. Any questions of the manager? There are a lot of boxes to go through here tonight and check. All set. All right. Thank you. Right on cue. Update from boards, committees, and other updates. Tonight, we do have an update from Midcoast Hospital. Lois Skillings, President and CEO of Midcoast Parkview Health. Christopher Bowie, Medical Doctor, Vice President, Medical Administrator, and Chief Medical Officer. Would that be Bo or Bowie?
It's Bovie. He pronounces it Bovie.
Oh, well, I would never have gotten that. Floor is yours, Lois. Welcome back.
Thank you so much. And first, I have to tell you that Dr. Bovie's wife's birthday is tonight. And I said to him, you know what? I think that is really more important. Family matters most. Go home to your wife. So I'm here without him tonight, but he helped me prepare all this information. So we're grateful to him as well. If you would like me to share my screen, I have some slides I can review with you, and then we'll have time for questions, if that's okay. If I can have permission, is that all right, Andrew? Okay, I'm
It's
going
up
to
to
give
the
it a shot.
guru. And go for it. Okay.
Okay, thank you. Excellent. So let me just get up to the top here and start it from the beginning. Okay. So we wanted to come back around to all the different towns to give you an update. We were here in May and wanted to come back because definitely the second surge of COVID is here. And I think you all know that. You watch the news and read the paper, but I thought I'd give you a local flavor of what's happening. And this puts things in perspective. Since March, Midcoast Hospital alone has administered more than 10,000 tests for COVID. And we've found 215 positive cases and 31 patients here have been hospitalized. The 38 patients who have been hospitalized, not all of them have been from this region. Some have been transferred from other communities in Maine as well. And this is obviously not the only tests that are being done in this community. You know, Martins Point is doing it. The Urgent Care Center in Thompson is doing testing, as are Convenient MD and some of the local pharmacies. But this will give you a perspective of the scope and scale. And this is really why I wanted you to know this, because if you look at this comparison, in the month of November, we've tested over 4,000 people and we've had 101 positive cases. So nearly half of the positive cases that have occurred here locally at our hospital have happened in the last month. So to date, we realized that the state of Maine is definitely in a COVID surge situation. And, you know, early on, what was happening in Maine, the spread was related to specific outbreaks that was connected back to an event or a gathering, something that we could actually go back and do contact tracing. Now we're seeing more cases that are not from a specific event. And it's really because people with symptoms are likely spreading COVID-19 without even knowing they're infected. And this is much more a dangerous time for our communities and potentially more difficult to contain this pandemic. And these are the measures that you've been hearing about since the very beginning, and none of this has changed. It's just become more important. Physical distancing of at least 6 feet apart, universal masking, even when outside in public. And this is different. I think over the summer, many of us were able to have outside visits with friends or family. And when we were 6 feet or more apart, we took our masks off in the summer. That is not the case anymore. People should just keep their masks on, whether you're inside or outside, and stay 6 feet apart at all times. You know, no gatherings of more than 10 people. I wrote the parentheses reality check in here. You know, I think I would avoid any gatherings unless it's absolutely necessary, because any opportunity to be mingling with other people is an opportunity to spread this disease. Obviously, hand washing and staying safe at home. And I know many of us had very meager Thanksgivings alone in our own homes, and we're looking forward to times in the future when we can safely gather again. So we've been preparing for a second surge of COVID for several months, and the epidemiologists and infectious disease doctors have been warning us that this was going to happen. And so Midcoast has been identified within the Maine Health system as a COVID-19 inpatient concentrated care site. So that is to leverage our clinical experience. We have a full service ICU with specialty trained pulmonary physicians and nurses. And this has us able to use the specialists and resources that are here. So Maine Medical Center in Portland, obviously, Southern Maine Medical Center in Biddeford, and Midcoast here in Brunswick have been identified as COVID inpatient facilities in the Maine Health system. We have separate treatment areas with dedicated teams for COVID patients, both in our ICU and our medical surgical unit. And as of today, we do have beds. We're getting tight on beds, but we have a contingency plan to create more beds if that is needed. And again, Maine Health supply chain is such a great advantage. Literally since April, we have not had any worries of PPE and don't see them, that personal protective equipment. In fact, we've been able to share some with local community nonprofits and other first responders because we've really been very well supplied with personal protective equipment to keep our staff safe, which helps keep our patients safe. So just to review, with any symptoms of COVID-19, these symptoms usually occur within 14 days. Fever, cough, and chills, a loss of taste or smell, which is almost a uniquely COVID thing that we've learned now in the last 9 months. Shortness of breath, body aches, and sore throat. Some people, though, never have symptoms, yet they have the disease and can spread it to others. And what we have also been seeing here and around the state, the country, and the world is that there can be a severe response to the infection that leads to a significant lung and other organ failure. At Midcoast, we've had testing options from the beginning, and we now offer a drive-through testing for symptomatic individuals. Up until a few weeks ago, we were also providing testing for asymptomatic people, meaning people who just wanted to test. I want to go visit my relative, or I want to have an opportunity to have a test because I want to go to do something or go on a trip. We no longer have the capacity to do asymptomatic testing here at Midcoast because of the surge that is happening. We're testing about 160 people a day, and we need to reserve that for those 160 people who are sick, have symptoms, or have had an exposure, or need healthcare services in order to make sure that they don't have COVID before coming in for a surgery that they need, or et cetera. So it's really dried up the ability to get testing for people who are asymptomatic and just want to have a test because of travel, has really dried up at a lot of the health systems. And they're still available at some pharmacies, and you can look online at the CDC site will direct you to where COVID tests are available. But there is very much limited now because we need to keep up with exposure and symptomatic demands, which is what is the greatest public health need and the greatest patient care need. Our walk-in clinic downtown, and obviously our ER emergency department for very sick patients, but our walk-in clinic does testing right there as well. And they do telehealth visits so that you don't even have to go in unless you do need a test or an exam. I had a tick bite a few weeks ago, and I used this telehealth visit, and it worked very, very well, using my phone from the comfort of my own living room to get seen for a tick bite a couple of weeks ago. And again, we have convenient testing from Nordex Labs with really good turnaround time. That's another great advantage that we have here locally because we're part of the Maine Health system. Our Nordex laboratory in our own Midcoast Hospital laboratory has very good turnaround time. If we had time and you were interested, I could talk to you about the difference between what's called the PCR test and the antigen test. The PCR test is the more accurate test, and the antigen test is less accurate, especially for people who don't have symptoms. And the only test we have available at Midcoast is the PCR test because of that accuracy factor. So staying healthy this winter, please get a flu shot. We're so fortunate that so far flu has not come to Maine. We don't want flu to be coming on top of COVID. Patients can get both the flu and COVID-19. And it's just really every winter, we have a lot of inpatients here with the flu who are very, very sick and get a pneumonia with it. And with being right up against capacity throughout all of Maine's hospitals, this is a year for us to try to avoid as much flu in the community as we can. We're asking everybody to avoid holiday gatherings and wear the masks and distance and contact primary care for needed screenings and other healthcare needs that you have. One of the worries we had in the spring is that people put off their routine care. And so cancer diagnoses could be late or other health problems could get worse. And we have found a way since April actually to provide just very safe care and separate out people with respiratory illnesses from those that don't. And because of universal masking, I tease with my husband. I come into work every day. He's retired. We don't go to the grocery store anymore. We use the to-go part. But I say to him, I'm safer in the hospital than anywhere else because everybody here has a mask on all the time, as well as eye protection when we're caring for patients. So I wanted to also mention that a COVID-19 vaccine is imminent and planning has been underway for months, and a phased approach will happen. We're really working, obviously the Maine CDC is taking the lead on this, but they've been working with the health systems throughout the state for beginning with phase 1A, which are healthcare workers who are directly caring for COVID patients, as well as elderly in nursing homes and the long-term care staff will be the very first wave. And we actually have an operational plan that we can begin those vaccinations as soon as they arrive. We have the special refrigerator freezer that handles these vaccines here, and we have staff ready, trained in a location here on site for our own staff. We're also beginning to work with public health and other officials around the community because we realize that soon thereafter, we're really hoping for more vaccine in the early part of 2021 so that we can begin a phased approach of vaccinating first people who are vulnerable, other first responders and essential workers, especially people over 65, people who have other chronic health problems, and anyone who lives in congregate living. All of these people will be, near the first phase. And then after that, later in the spring, and there's a great hope that we'll have enough vaccine to begin doing mass public vaccination efforts. Of course, all of this is voluntary. Even with our own staff, we're not requiring COVID vaccines, but I can tell you that our doctors and nurses are being trained on the efficacy and the research of this vaccine. Actually, this week and next week, there are educational programs for our doctors and nurses so that they all understand what we know about the COVID vaccine. And from a healthcare professional's perspective, I would tell you that the greatest advance in healthcare in medicine of the last century was the vaccine. And it's why we don't call COVID-19 the plague, because we now know things like smallpox, polio, and other terrible diseases that were so impactful on life expectancy and mortality in the past centuries, where some of them were nearly eradicated within the last 100 years because of vaccines that happened in the latter part of the 20th century. So I think with that, I will stop and ask any questions. We have an info line. People can call at any time for questions, 373-6699. That's staffed during the day, 8 o'clock to 5 o'clock. And there are nurses there that will answer questions about exposures. And that's also where people call to get their testing scheduled. So I think with that, I'm going to stop my share so that we can just have any brief questions or anything that you have on your mind.
Go ahead, Ruth.
I have a question about masks. I do believe in them and I wear them every time I go out. However, I don't know how much harm they do if you wear them all day because you're breathing back the carbon dioxide. I've heard quite a few things in the last month about that.
Well, I can tell you, I'm in here now with my door closed in my office, which is why I don't have my mask on, but all the healthcare workers, all the first responders, the people that you see wear our masks all day long. We wear them all day long. The disposable masks at the end of the day, you throw away. Your cloth masks that you have, you just wash after the end of the day. It doesn't hurt you to be, it doesn't hurt you to be rebreathing the air because they're not totally impermeable. So all our healthcare providers and everybody, we wear them all day long. We even have our patients wear them, the ones that can tolerate that. So I wouldn't worry. What we do ask is that those things, I can't remember what they call, but those things you put around your neck and then you pull it up over, it's like a piece of cloth. Those are not, what are they called again?
Neck gaiters.
Yes, neck gaiters. The data has shown that they are not very effective. So we really encourage people to either use the disposable ones or the cloth ones.
Thank you.
Yep.
Lois, you had spoken about the treatments people held back from in the spring and the steps that have been made for cancer patients and such. As far as your knowledge, is pretty much all offices are open and running. People can still, even though we're in the middle of this
Yes.
increase, they can still go out and get the care they need.
Absolutely, because of the safety measures that have been in place really since early on in the pandemic, but we really got into the groove. It took us a couple of weeks, I'm sure. The beginning of April was when universal masking happened throughout the United States in healthcare. So since then, the safety measures, it's been very safe. And so we have all of our offices are open, all of our procedures. The only thing that would make us stop is if this gets worse and we need the space to create another COVID unit, or if we need the staff, if we need to redeploy those doctors to help in the hospital and nurses to work in the hospital. But so far, we're not at that stage at this point, and it's very safe. A lot of the doctors are offering telehealth visits, though, just for people who just may feel more comfortable, or it's just more convenient to have a telehealth visit from your computer, your phone, or your iPad if you have access to that. But all of our offices are open. We're still doing surgery, everything as if it's normal.
And then last question, it's sort of a COVID, but I know this late summer, early fall, you were able to allow visitors to visit patients.
Yes.
How is that still being allowed? I know that was, and I think for a lot of people, it's just that being there by themselves. And I'm wondering, how is that being viewed at the hospital now?
I think I'm really glad you asked that question, and I was going to mention that. So it's a really good thing that you did. This has been one of the hardest things about the pandemic for healthcare is the fact that we've had to restrict visitors. Because of the rise in COVID in the community, actually, as of beginning tomorrow, we did open it back up again quite a bit, but as of tomorrow, we're going to close it back down again. We have always had visitors, and we call them support people for children, for people who have communication or are confused and are not able to communicate, for people who are at end of life or when a care decision needs to be made or on admission. We've always allowed for a support person in those situations, including in the ambulatory or outpatient environment. But for all other visitors, we're going to begin significantly restricting it back again tomorrow. And we hate to do it, but it's really the only way to keep our staff safe and the patients safe, and to decrease the density of people in the building, so that we can focus on taking care of the patients and keeping everybody safe. It's harder, the more people you get in a small room, the harder it is to stay 6 feet apart when you're in there taking care of the patient and you giving medications and everything else. So we had wonderful donations during the spring from people, and we purchased a lot of iPads. So we help our patients stay connected if they don't have their own device to be able to be with their loved ones, so that they can visit with them that way. But all of us actually throughout Maine are beginning again tomorrow to cut back on visitors.
Thank you. Any other board members have questions for Lois?
Well, thank you for the update, Bill. It's been very helpful.
Well, and I would just like to thank all of you and thank the community, because I think this region of Maine has done just a really good job in complying with all of these safety measures. And it's why the burden in Maine has not been as great as in other states. And to just thank the community for your great support of our healthcare team. They're tired and they're working very hard and they're doing amazing work. And I couldn't be more proud of them. And we'll all be looking forward to a new year when a vaccine is in place and we can begin to fight back with this disease. So thanks for giving me a few minutes of your time, and please feel free to invite us back anytime, and appreciate it.
Thank you, Lois. Take care. Next up, update from the Comp Plan Implementation Committee, Susan Ray Reeves. One of these boxes here. There we are. You're on mute, Susan.
Mute, but I
There we go.
thought I might see myself, but no. Can you all hear me now?
We hear you fine. Just
Okay, great. Thank you. So hello, everyone, and really good to be with you tonight. I'll refer directly to the plan. I think everybody's to the work plan. Everybody's has that in your packet. The Comprehensive Plan Implementation Committee is really appreciative to have the chance to sort of let you know where we are in our process. And as I was listening to Lois Skilling's, I couldn't help but think, what would have happened if the town's cycle were slightly different and we were needing to update our comprehensive plan now? That would be really, really challenging. As it is, we have an implementation committee that has never met around a table. But we're working together just fine. So referring to the work plan, what you'll see at the top of it is a very brief section on our current status, updating you on our current status. And that starts with the spring and summer of 2020. But I just want to go back to January, because that's where really things started, where 3 of us from the Comp Plan Update Committee came before the Select Board and said, we're willing to serve, and you appointed us as the transition team. So we got busy doing 2 things. Reaching out to people who had been very active and interested during that whole process of updating the plan, and talking with them, and we've got a great committee. And the other thing we did is we met to really focus on the section of the plan at the end, which is the strategy for implementation, the strategy matrix. Now, I don't know if any of you have spent much time with that strategy matrix. I remember doing a workshop, all of the update committee did a workshop with the Select Board, and there were a lot of questions and we had a lot of good discussion, but I don't remember really talking about the last section at all, because that wasn't before us. That's implementation. Well, let me tell you, that's a very interesting section. And we looked at that upside down and sideways, and we said, this is not workable. So thank goodness one of our members was willing to keystroke that thing and turn it inside out and make it operational, because the way it's organized in the plan, it is organized by the big ideas. So it tells you, what those next steps are, what those tactics and strategies are, and which departments are going to be the lead on those and which are going to be the support. But as we work on implementation, we needed to turn that around and organize it by the departments and the commissions that we're going to be working with. And so those are the 2 things we did over the spring and summer. We recruited a great committee, and we got that thing organized so that we got our heads on straight so that we could really begin work. COVID kind of set things back a little bit, and it was in August, I think, that you all met to appoint the committee, and we appreciated that chance to get started. It's a strong committee. It's a really good mix of people who are retired and working, people who have never served on a town committee before, and others who have served on several committees. So it's a good mix of experience. And at our very first meeting, we decided that we would meet, by your charter, I think we have to meet once a month, but we're going to meet on the 2nd Monday of each month. And we meet from 4 to 5:30, which accommodates both the retired folks and the working folks. And that seems to work well. And now meeting only virtually, we've been really pleased to have some town residents join our meeting. So the interest is strong from the start, and we appreciate that. So here we are at the fall of 2020, delivering the work plan to you folks, and we would love to have your feedback, any questions you have. So let me just start out with that. That implementation matrix is really the key for our work. And as you know, we've had 4 meetings, and this plan is very interesting. It's got a great vision, but it takes a little bit to get your arms around it. But it's happening, and it's felt really good to work as a committee. This is a very short work plan. It's just about a page, but it has everything we need in it to guide our work. And each of these items, we have no idea really how long each of these is going to take, but we're going to be really happy to keep you informed. So let's look at that first item, the work plan outline, prioritizing the comp plan objectives and implementation strategies. What we've started to do is delve into that implementation matrix. The various town committees, commissions and departments all have major roles. But as we sat down as a committee to talk about how that was going to work, we realized that one of the units that has some significant responsibility is the town manager. And so we sort of paused and we scheduled a meeting with our town manager and our assistant town manager. And that was a wonderful opportunity to just sort of, see where we were. And we learned, as the whole committee didn't attend, I attended, and our vice chair, Rick Schultz, attended, and Larry Fitch attended, and the planning staff. And we learned that the comp plan has already been utilized to guide some of the work going on in the town. Now, that was a surprise, and it was really encouraging. And after that meeting, what our request was for the town manager and assistant town manager to bring that information to the various department heads and let the department heads know that we will start at some point soon meeting with them to work through how their annual planning process and the goals of the comp plan align. We want this to be a really workable, comfortable process. We're planning on, sort of making assignments soon and getting those meetings scheduled. I think that will start to feel very real, in 2021 when we start to actually meet with departments. When you look at the next item, which is zoning updates, zoning is a really important area. And the goals of the plan need to be looked at in a big review of zoning. So at some point soon, that will come before the select board. And we obviously will be working with the planning board very closely. Meeting with stakeholders, that's meeting with departments and commissions. And you probably do, one of the things, if you were involved very deeply in some of the meetings of the update process, the big idea that was the most, popular was streets for people. And I think there were some people who were very involved in giving us feedback throughout that update process. And I've heard from a couple of people who said that they have been actually working on this and wanting this for about 20 years. So the time has come. It's number one it's number one big idea. And initiating a master street planning process is number 4. Each of these things involves a lot of other steps. We don't, as you see, we don't have a time frame on this, but as we have comp plan update cycle of 10 years. We figure we're going to be working on this for the next few years. So this is a very important first meeting, I think, which is to let you know where we are, to hear back from you if you have whatever questions you have and feedback, because the select board obviously is an important partner in implementing this plan and moving the ideas forward. So with that, I will be glad to hear any questions or comments you have. Thanks.
Matt?
Susan, I have two, but I'll ask one first and then I'll punt it to somebody else. First of all, this is fantastic. Very exciting to see this moving forward. Hoping to see Mr. Fitch here soon shortly too. What was my question? There it is. All right, cool. So in your, I guess question or bullet 5 in the CPIC work plan, you're talking about developing the succession strategy and continuity of institutional knowledge.
Yep.
That's a really, really, really important bullet.
Yes.
And I would just want to emphasize that one. It's not sort of fleshed out like the other ones, but I mean, that's something, at least in my opinion, you guys should be thinking about from the very, very early stages about how to implement that kind of strategy. So that way you can sort of keep it in mind as you're moving through the process. Just personal advice. And then, let's see, the other question, you're talking about a tool. Oh, sorry, I'm sorry. I just, I said I'd take a break. So Dave, sorry.
You didn't
Thank
ask,
you for that, Matt.
It was more of a comment.
as you say, you didn't ask anything. You only made a comment.
Yeah, that was a comment.
Susan, and that you kind of answered it early on. You had talked in part 1, prioritizing the comp plan objectives, and it was you guys had sat down with the town manager and the assistant town manager, and we're happy to hear that this is already being used, the comp plan. And that's kind of how I have always looked at the comp plan. It's here in front of us. It's not a mandate, right? But this is where we want to go.
Right.
So knowing that the department heads are already utilizing it, how do you guys, so this is an interest to me. How do you come with what a priority should be on where to tackle versus what they're already doing because something's already happening? Do you see that that's going to, you know, as projects or particular things are coming, is it coming too fast that you can't get to the items that you're going to want to prioritize? How have you thought that out? Or does that make sense?
Well, it does. No, it does make sense. And it's one of those things where it sort of like feels like double Dutch jump rope. I was never very good at that, but when you get in the groove, and I think how I'm viewing it and how the committee is coming together around this, around making these decisions, is understanding that, you know, the work is going to proceed department by department. And each department has its own sort of annual work cycle of planning, budgeting. It's a matter of reviewing the items that fall into their bailiwick and having conversations with them. Our role is obviously to, you know, as I wrote in my memo, to champion the plan, but it's also to provide support. And sometimes departments will work together. There might be, I mean, we don't know what to envision at this point, but what I do know is that there's nothing that we intend to do to impose anything. You know, this is a vision that was created collectively with a huge collective. And so it's a matter of creating a process where the town's regular work can, you know, the only word I can give you is to sort of do our best to help that get aligned with the regular work and the new ideas. And, you know, we don't know what to anticipate. You know, this may be an easy process of flow, or there may be some challenges. There usually are challenges, you know. So, you know, we'll work them through. We'll work them through.
I appreciate the answer because, as you know, as an individual, I'm sitting here and look through you moved again, and you look through, you know, the comp plan. I don't know how you would decide where you prioritize. To me, it's one of those things, just as you said, it makes me feel better that, there's at least two of us here that know that a lot of it's going to happen naturally and you got to tackle it because it's so overwhelming. And when I saw, the prioritize, I just didn't understand how anyone could do that with such a document.
Right.
There's so many things there, and we want to tackle everything, and we love them all. How do you do it, right?
We appreciate that you understand the challenge.
Thank you, Susan. I think thank you. I feel that you've done a great job, and moving forward, I know you give it your all, Susan, as you do on all your committees. The thing I'm interested in is in the streets, on how you will proceed with that. And I would like some point, maybe not tonight, you explain that, but not tonight.
Thanks.
You're welcome.
Matt, go ahead, Roland.
Thank you. Yeah, I just want to echo the earlier comment that Dave made. I think the scoping exercise is probably going to be the biggest challenge you'll face because, again, everything that you plan goes wrong eventually at some point. So, you sort of have to put that extra amount of time in place to sort of think about as many contingencies as you can when you're talking about actually implementing some of these projects, which may be capital in nature, or they may just involve a lot of education. But in any case, it's sort of, having individuals who are dedicated on these individual items put in the extra work so that it's successful as it rolls out.
And education and training is a theme that is throughout that that strategy matrix.
Thank you.
Would you like to do number 2 now?
Yes, please. This is actually a question too.
Oh.
So for the tool to monitor the implementation of the plan, I guess operationally speaking, are you planning on, let's say something's not working, would that tool, whatever that may be, in terms of monitoring the implementation, would that enable you to sort of go back and correct issues, or would you guys be planning on sort of saying, okay, this didn't really work out, let's punt it to the 2030 comp plan update and see if we can maybe look at re-examine this big idea, or maybe drop it entirely or something like that? Like, is there a plan, I guess, during the implementation process in the interim to self-correct?
I think we'll have two things going on. I mean, we're going to have our monthly meetings, and the committee, we are 7 people. We're going to sort of spread ourselves among the departments, and my intention is for us to work in teams and bring that back so that there'll be work going on between meetings, bring that back, have those discussions in meetings. I don't think not working is going to happen. I think it might just work in surprising ways. And so what we want to do is stay open to, I mean, the town in a way is an organism, and we want to have a healthy, vibrant organism. And I think over the years that planning ideas have evolved. They've changed a lot, and we can benefit from that now in terms of helping to keep Topsom, to preserve the things we love, and to bring about the ideas that people expressed. But it's not up to us as a committee. We're just part of the team, as are all of you. So we intend to come back and work with you on a regular basis. We'll be working with the planning board. We'll be working with all of the various departments. There are a few departments that have only a very light responsibility, so we won't be tormenting them, but we'll be working with them, and there may be ways in which departments will work together. We're learning as as much as anyone else is. And we're happy to engage in that learning, you know, with the various departments. If there's a not working experience, we'll let you know.
Awesome answer. Thank you, Susan.
I would have said punt, but good call, Susan. Any further questions for Susan? No, Susan, I just want to, you know, sitting here tonight, listening to you, how you guys have approached this, how you reworked the section already, found it's not working, and the mountainous amount of work you guys have before you, how you know, to chip off a little bit and designation of the work. It just reminded me of all of our boards, all the boards and committees. It takes every single one of those groups to make all of this happen. Nothing happens with one. You guys have bit off a lot, and I am so thankful for you, because it takes a special group to do that. But just for those at home, there's so much that needs to happen to run a town, to make it what we want it to be. And this is an example of that it's not one group that does it. It's spread out among many. And it'd be great if we could continue to have many doing this stuff.
It might be worth mentioning, it was at town meeting 5 years ago that I heard the call that we need volunteers. And so I went in and talked to the town manager. And, you know, it's a wonderful way to get involved with our town. So we have a great committee. Thanks.
Absolutely. Thank you, Susan.
Thank you.
All right. We are on to correspondence. Sorry. I got so many things going on here. So if anyone has any correspondence from the public, this would be a time to read them. Also, if you're home and you have a general comment that you'd like to make to the board, you can call 373-5090. Not about any particular agenda item if you don't want to talk about it, if you just have a statement to make, or we will continue to utilize the technology before us. You can raise your hand within Zoom. Did anyone receive any correspondence, or did we and I forgot them? Seeing a bunch of shaking. Oh, go ahead,
I
Matt.
did, but I think it's going to be, actually, I believe it's going to be called in later on, but just in the event that that doesn't work out, I'll read it later on during the agenda item.
Okay, perfect. So while we wait to see if there's anyone that calls in or anything.
Dave, we do have someone raising their hand.
Oh, why is that not showing on my screen?
Jenna Godo, I can allow her to talk.
Yeah, can you do that? Because I don't have any hand showing on my screen.
Hi, this is Jenna Godo. Can you hear me?
Yes, we can.
So I just want to be clear, I haven't done this yet. So should I wait for the agenda item, or am I supposed to, should I speak to an agenda item later now?
You are free to do as you will. Usually what this is, Jenna, is if you just had a general comment for the board, if
Okay.
there's something you wanted to bring to our attention, but it always makes sense.
I can wait then, that's fine. I don't mind waiting. I just wanted to make sure I didn't quite make sure I was doing it correctly. So I'll just sit tight for a bit. Thank
All
you.
right, I found the hand section, so I'll be able to watch now. But thanks for bailing me out, Andrew. So while we're waiting, as we're looking around, we will at least jump to the consent calendar. I'll make a motion to approve the minutes of the regular Selectmen meeting, November 19, 2020. We got a second. All those in favor of the minutes as they were presented? 2, 3, 4.
Abstain.
Oh, okay, sorry, thank you. So we got 4 and 1 abstention. I see no phone calls. I see no hands for the general. We're gonna move. There's a lot of items here. We are moving on to public hearing. We have 2 tonight. First one up is 20-88. Consideration and any appropriate action on approving a marijuana business license application cultivation tier 2 and product manufacturing located at 12 Center Park Road, tax map R05-056-2, submitted by Icewater LLC. So this will apply for both public hearings. I will gavel open a public hearing, and once that public hearing is gavelled open, people will be free to make public comments. I honestly look for a little update from either the planning board, the planning department, or even the individuals themselves, so we can ask questions. And once we gavel close a public hearing, there'll be no more questions or comments from the public. All questions will only come from the board. So perhaps, like Mr. Wintle, you'll want to stay on for that if we had another question, but there'll be no more public comment. So that's what will happen. Let's get into it. So I gavelled that open. Hopefully you heard that. We are open for 20-88, the Icewater LLC. Sorry here, let me get, first of all, I do want to give some thanks to the planning department for providing us these books of information. They were extremely helpful this time in the work that it took you guys to put it together. So we have Rod and Randy. Would either of you like to give an opening statement about what you're looking for? I mean, obviously we know, but just for the general public.
Yeah, sure, I can absolutely do that. And then Randy, if you have any gaps you'd like to fill in. So we're a small organization, as you can tell by the size that we're asking for, compared to some of the others in the state. But what we're looking to do here is, be involved in the adult use marketplace in the state of Maine that has recently opened and will be ramping up over the next, probably next 12 months or so. We do have some background in running operations in the past. Actually, most recently, Randy is actually still operating as a licensed caregiver. Primarily, his customers are actually medical marijuana storefronts. So much like what we intend to do with adult use, which is cultivation and manufacturing, we really have no interest in doing retail sales or that type of traffic. We instead have built up a fairly large distribution base. We're in 7 stores across the state from a medical standpoint, at least Randy is. And this will be about kicking it off to the adult use stores that will be opening up. So it's a small company, as I said. It's basically me and Randy, who's my son, and a long-term friend, technically treated like Randy's uncle, kind of, named Lance, who couldn't make it this evening. But yeah, small organization. That's really us. I don't know. Do you have something, Randy, that you want to add?
No, nothing really. Just the fact that I think you covered all that. We're an existing business. We operate in a small craft market and the higher end market in the medical side. So we're a pretty well sought after brand. And we make kind of the small craft specialty products, not really a big, large scale operation. It's me and my wife today that do everything, and we're gonna, have a small team hopefully together here in Topsom to bring that same high quality product to the 21 plus market.
Yeah, if I could add just one more thing, Randy, you made me think of, is that the manufacturing processing that we do is all non-hazardous. So unlike other companies that you may have heard that use some very, scary chemicals, toxic chemicals like butane and others, we don't do any of that. The reason the company is named Icewater is because that's the magic, if you will. It's really about washing the product and extracting more of a pure version of it. So no hazardous materials, no explosions, none of that type of stuff. It's all ice and water.
Excellent. Are there, Rod, you would want to come up for a second, please? Thank you. Before we jump and I look for any public comments or anything, is there anything you wanted to, from your office or any staff, that you wanted to make sure is out before the public talks?
Well, you received the memo, I hope, that was drafted. We conducted a staff review. All the application seems in order. As of right now, I think there's still, it's kind of a chicken and the egg with the state licensure. Typically, the state offers a conditional use, conditional license. The town offers a conditional license, and when they both look at them, they get their license from the state and the town. That's how I understand it anyway. So if they're successful here tonight, then they would finalize that with the state and then come back to us and finalize as well. You're on mute, Dave.
Sorry. Is there anyone from the public that would like to comment? And then we'll allow any Board of Selectmen have any questions that they want answered here. Go ahead, Ruth.
I just have, you've been operating on a small basis now, like you said, in healthcare. There has been no slapping of the hands from anybody or anything. You've been doing it, right? I just had to ask that.
No, we are. No, we're really clean. That's been, one of the things that I'll say is that, we have our background has not been in this traditionally. And in the last few years, I got into it. So coming from a different approach there, always been in the legal market, if you will. So yeah, we have a clean record. And as part of that state process, they are very adamant about that, including all the background checks, but also they review our tax records in the state, as well as our policy records with the state for medical. So everything that's normally hidden is uncovered in this, if you will, right? So we are approved there.
Thank you.
One of the things, and it doesn't matter if I ask, I'm just checking a bunch of areas, make sure no one else wants to speak. One of the things I noticed from your application with the town, and what was the exact wording? I wrote it down in the main operating plan template. You had working hours Monday through Friday just on the state, but on the town's application, you had Saturday and Sunday, I think 8 to noon, if I recall. And they still meet within our guidelines, but I just would like to assure that they match up what's being applied for through the state and through the town. So, and I'll make that as we come out, as we discuss this in a more permanent situation, but I would like them to match up. Your hours you put on the town's application are perfectly fine within ourselves, but it's different from the state. Was there a reason? Did you guys change that? Oh, we need to be here on Saturday, Sunday, tending?
Maybe that was wishful thinking on my part, that originally we would have weekends off and then went back to working on the weekends. No, I honestly, that may have just been an oversight, and apologize. We can get that lined up for sure.
Yeah, I think it's reasonable though to assume that there would be visits to the site on Saturday and Sunday. I mean, in a cultivation facility, it's usually you don't go too long without it. We have a lot of monitoring and stuff, but unlike a retail store, again, even being open would be a result of, there being a couple of people on site, but no real noticeable or perceptible difference from the outside as far as noise, smell, any of that type of stuff.
And just as, so I understand, when I was looking at your plan, you had 3 mature areas, and I think they were 480 square feet, maybe was the number right off. And then you had 2 areas, I forget the exact, I'm trying to find the pictures, 2 areas. You have the ability to go up to 2,000 square feet. Do you see that this location, you're eventually wanting to get to that point? Is that your goal, or you see you're maxed out where you are?
Yeah, we will be leveraging, I believe, approximately 1,000 to 1,100 square feet of actual flowering canopy in this original plan. And we're applying for 2,000. We do have room to expand both in that existing building, and there is potential for another building on that lot as well, that we are also, in future discussions potentially for. So that's what we're looking at right now.
Okay. And you're using that entire building now, is the plan, right?
We have two, what would it be, 3/5 of it, I guess.
Okay.
There are 5 units. We have units 1 through 3.
Okay.
And there are 2 other smaller spaces. So each unit is 2,000 square feet. We have 6,000 square feet is what we've currently leased there.
And that question's more for me, just trying to picture all this as it's so new.
Sure.
What it looks like and takes. All right, if there is any other members of the public who would like to make a comment for this before I close it and the board will discuss. I'm seeing no hands being raised. I am seeing no phone calls. You agree with that, Andrew? You don't see anything, correct?
You're good.
All right. So at this point, I'm going to close the public hearing. Oh, thank you, Rose. I'm going to close the public hearing. And now we'll discuss the actual licensing. The question and any questions will come from the board only. And is there anything else that the board members would like to ask? We all received the memo, because I'm trying to find the proper memo here. So as Rod had stated, the town's gone through everything, checked the boxes. And it meets all of our guidelines for up to 2,000 square feet. And so one of the things, as I make this motion, if I do make the motion, and we talked about it, I would like to see, it does make sense, you're going to need to be there on the weekend. You're not going to let it go for a couple of days. But just if I want to have the both applications, state and the town, to marry up. As far as the town's concerned, yours is fine, but you'll want to update that with the state that you'll be there. Now, Rod, would you anticipate that we just put that as a condition for awarding that? Okay.
Just as you stated, Dave, that sounded good.
Okay.
To amend well, actually, you found that the state one did not find the weekend hours?
Yeah, it was.
I can tell you guys, we will have another round of these documents being put together with the state and with you guys that will be for our active license, including our inspections and occupancy inspections and all of that. So I think that if you, as a conditional of following through with the process, that will get covered.
Well, and my 2 cents, Dave, would be the added condition reflects the enforcement capabilities of the town. Yep. So you're concerned with what they're submitting to you as a town because they're attesting to the operating requirements that are embedded in the code, the licensing code. They don't exist today, so they're telling you that they're going to meet all of these requirements. So that's one of the conditions mentions that currently should.
Probably does.
But if there's confusion as to what was written on the state one, just having the applicant clarify it and noting that as a condition that as part of their operating requirements, that seems to make sense.
Yeah, it's just days and hours of operation under the operating plan template for manufacturing facility. They just had closed on Saturday, Sunday. And their hours for us being 8 to noon, they're within guidelines. So our application's fine.
As an FYI, the state does allow us to amend throughout the process, so we can make that amendment and absolutely 100% agree that they should match. So if the state is evaluating the same thing as you, so we will update our state application to show the same set of hours.
Just so the board's aware, this is the second and final tier 2 cultivation facility if approved in the town. Security will be in place. Sorry, I'm just going through this one last time. Signage, 1 site per business allowed. All right, is everyone prepared for a motion? Let's do it. Thank you for the potential motion. So this motion, a motion to approve the application of Ice Water LLC marijuana cultivation facility tier 2 license and marijuana product manufacturing license based upon the findings of fact as listed in a memo from the town clerk, Linda Dumont, dated October 29, 2020, with the following conditions of approval. The applicant/facility may not operate as a state licensed cultivation facility and/or product manufacturing facility until such time state marijuana licenses are approved, delivered, and reviewed by the town clerk's office. No changes to this approved license are allowed to occur. The applicant must return to the Board of Selectmen for any license renewal or amendments. And the third one, I'm going to put that the application for operating hours with the town application and the operating plan template for the state application match. Do I have a second?
Second.
Patty, you get to do the glorious duties of this.
Okay, you've heard the motion. How do you vote, for or against David Douglas?
For.
Marie Brilliant,
For.
Ruth Lyons,
For.
Matt Nixon, and Roland Tufts.
Or.
That is unanimous in favor of.
Thank you, Patty. Congratulations, gentlemen. Wish you the best of luck. It seems like you got many more steps to go. But best of luck. Stay in touch with the town. And thank you for coming.
Yeah, thank you very much. We look forward to working with you guys. We'll be in touch and be working closely with you. Thank you.
All right. Close one book and jump to the other. So again, so now we're going to go to 20-89. Consideration any appropriate action on approving a marijuana business license application, registered caregiver retail store and product manufacturing located at 55 Town Fair Mall Road, tax map R05B, lot 009-B, submitted by 4207 LLC, Highbrow, and Highbrow Edibles. Just like the last public hearing, we will, once it's gavelled open, we will take questions from the public, comments from the public. I would look again for, Rochelle, will you be handling? Okay. And, you know, an update of what you're looking to do. And if there's anything the planning department would like to give us. So I'm going to operate it the same way, and we're about to gavel open. We are in public hearing for 20-89. Rochelle, would you like to give an overview of the plan before us?
I'd be happy to. So thank you for having us, and also thank you for the past 3 years of wonderful experience in Topsom. What we are proposing is to move the existing caregiver storefront. I am the business manager for Highbrow, and I operate for Charles Doherty as well, who operates 4207. It's his caregiver business. We've been operating for 3 years in the Topsom Fair Mall in Suite 19, and have had wonderful patients there and experience with the town. And we are proposing to move that location into the Ruby Tuesdays, which was vacated obviously during COVID, ended up stopped operating, and we had the opportunity to work with John Larson to take over that building. The caregiver business will only take over a section of the building. It should be included in your packet that the left-hand side of the store, the left-hand side of Ruby Tuesdays would be converted into Charles Doherty's caregiver business. Then the kitchen is what we're proposing to have our Highbrow Edibles, which is going to be just edible processing. There will be no hazardous materials. It's not processing concentrates. Everything is brought in already processed that we use in the edibles, and then we're just making edibles such as, you know, cookies and candies and that type of thing. And then not included in your packet, but it was discussed with Rod and Linda prior to this, the right-hand side of the building will end up being Highbrow Rock City Coffee Shop. We're partnering with Rock City Coffee out of Rockland. So that will be completely separate, and it does not have anything THC related. It's just a coffee shop. But so that's our proposition. And we appreciate you giving us the opportunity to be here and present this and hopefully do business again.
Thank you very much, Rochelle. Rod, is there anything from the planning department you would like to speak to before I jump to the participants?
You received the memo and the application. Again, we conducted a staff review. As you know, there's an existing business that has a track record. There were no issues found with the existing Highbrow caregiver store. The space moving into triggers a new license for them to seek. So they cannot transfer license of ownership or location. So Highbrow caregiver store is looking for a new license. And essentially what that would mean is they're forfeiting their existing one, allowing them to obtain this new one. Product manufacturing, again, it appears to me and I think it's included in your packet, that they actually have received conditional state licensure there. So when they receive anything from this town, they go back to the state, then they come back to us. That process-wise, I believe that's how that works. So for their product manufacturing, they've received that state license, it appears, conditionally, and nothing triggered any planning board or planning office reviews in regard to site plan, Ruby Tuesday. There's no architectural changes, no site changes, so there's nothing to review on that realm. So strictly, it's a license application in front of you tonight.
What did I do? Thank you. Jenna, I had you. I'm going to. Jenna, if you can hear me, you can go ahead and speak. Jenna, go ahead.
Can you hear me?
We got you.
All right, perfect. So good evening, everybody. Again, thanks, Jenna Godo, to West Wind Drive. So first, thanks for hearing my comments, my second round of comments tonight. I'd like to first say that, as some of you probably know and maybe recall, I've been working in the field of public health for over 20 years, and specifically in the realm of youth substance use prevention for just over 6 years as a prevention specialist. I had also worked on the town committee that made recommendations to the select board regarding our local regulations specific to marijuana. This committee began after the town votes for the retail sites, and after Highbrow had already located themselves in the current mall location. So as a prevention specialist, we use science to make recommendations and guide our decisions for best practices. Research has shown us that the increased normalization or the acceptance of and a decreased perception of harm and an increased access to any substance, as well as, including outlet locations and advertising, it all increases youth use. I acknowledge very wholeheartedly that marijuana is a legal substance in our state for adults, as well as those who attain a medical marijuana card. And with this legalization naturally comes a decreased perception of harm for our youth, as well as a normalization that it's a safer product, or a safe product, or a perception of a safe product. I have specific concerns regarding this proposal, primarily related to the location. So ways that we can negate this decreased perception of harm and normalization that pertain to this license is with specific location and signage. So I'm just going to keep this pretty brief, and just my ask of you is for you to really consider what role we want to play as a town in the promotion and the advertisement of a prime roadside location in our popular Topsom Fair Mall area, with 2 different marijuana businesses under one roof, and the coffee piece that I was unaware of, which is an additional draw, with greater visibility and footprint in a high traffic area. The signage or the specific advertising in a more visible location, in addition to the number of signs that I believe were included in the application, would probably need a little clarity, is concerning to me. And I know there are town specific rules that we have regarding the regarding signage that we had included initially, unless something has changed that I'm unaware of. So in closing, I'll just say that while marijuana has been illegal in Maine since late 2016, we are now really just beginning to see where this is going. And I think it is important to take a slow approach, as there really are so many unknowns remaining. And this includes the medical marijuana market and retail market that is newer to us here in town in a different way, and it is different than the adult use, I understand that, but it is still a fairly new market with a lot of people requesting changeover or doing the dual licenses for caregiving, and now the adult use. There's some other concerns that I wonder how this might play out later on. So I guess I would ask that you all choose how we continue to represent ourselves with our youth and our visitors to the Topsom Fair Mall area with this decision. Thanks for your time. I appreciate it.
Thank you, Jenna. I am checking other panelists and attendees. This moment, is there any questions just before we close?
Mm-hmm.
So I'm seeing no other hands come up for the public hearing. So this is the last opportunity for the public to speak. The rest of the questions, comments will be for the Board of Selectmen after we gavel out. Giving anyone the last second here. Seeing nothing, I am going to close the public hearing portion of this agenda item. And at this time, all questions will come from the Board of Selectmen as we consider the agenda item. The first question I've got, Rochelle, is and this is similar to what we saw with the earlier applicant, and you had an explanation in your memo of your packet. The hours of operation, 5 a.m. to the state, 8 a.m. Is our standard here in Topsom. Cannot operate before that. And I know the memo spoke to the cleaning that needed to take place. That's why the 5 a.m. portion. So what you're saying is you're going to leave all the cleaning overnight and do it then the next day, several hours at 5 a.m.
That's not for cleaner, like because we'll have a professional cleaning. We have a cleaner now that comes in, and she comes in early before the store opens to do cleaning. So the same thing would apply so this specifically for the kitchen. The caregiver storefront wouldn't open at 8 a.m., but the kitchen, we need to have cleaned prior to them coming in to make sure that they're, working in a clean space. So that's where those hours came from.
And I understand that, but it very specifically says you can operate 8 a.m. to 8 p.m. And
so that's fine with that. We're fine with that. We can do that. We can modify it. It's not really an issue.
Yeah, and I understand. I mean, if we allowed the first one to change the hours right up front, that to me, that just wouldn't work.
I'm sure kitchen staff would appreciate that anyway.
Yeah, I would think so. I've got a couple here. If anyone wants to jump in and we can spread it out, I don't care, or I'll just keep asking. Your floor plan, as was put in to the packet here, appears to have access from the kitchen into the coffee shop. And there's a doorway from the coffee shop into the medical facility.
They're limited.
Is that accurate?
Oh, sorry, I didn't mean to cut you off.
No, I
They're
just want to make sure that I don't read plans professionally. So I just want to make sure I have it right.
So they're limited access doors. We will actually be, I don't know if you guys are familiar with the Ruby Tuesdays doors. They're the typical swing kitchen doors right now, but we're in the process of changing those because even under state adult use law, the kitchen will have to be all limited access. You will not be able to enter that area unless you are certified with an adult use card from the state and are an employee of us. So those are actually in the process of being changed out to be able to be lockable doors that we use in our other locations like keypad entry. So you'd have to be an employee to be able to get back there. So there won't be that free flowing in and out that you guys are familiar with or have seen due to the state laws and the requirements. And of course we want to keep that access limited anyway, because we don't
Well, okay. That makes more sense to me because I was just seeing a free flowing place from a kitchen to the coffee shop and I saw a lot of bad things happening.
Definitely not.
And I guess I'd be remiss if I know the coffee shop and all this is going to go through the planning board, but getting this license is still something that comes on the Board of Selectmen. And Ms. Gatto was correct. You know, we don't allow product to be visible from the outside, right? Would
Correct.
there be windows looking into the medical care facility from the coffee shop, or is it completely separated, a solid wall?
The way we were planning it was to be walled off. You can't come into the caregiver space anyway unless you have a caregiver card. So we're gonna medical card, excuse me. So we're gonna be checking IDs, obviously, if they were to enter. The primary entrance for the caregiver shop is going to be on that left-hand side of the building. If you're facing the building from the road, that's close to Panera. And we'll have to check IDs before people even come in.
There will be access from inside the coffee shop, but it has to be ID'd and controlled in.
Yes.
Rod, so then this gives me a question for you. And it's confused, I guess it's building blocks. Does building blocks, what are they? Are they a daycare facility? Are they a school? Because when I read, it talked about the section of MRS, I think 20 maybe it was, or whatever it was. We defined exactly, and the state guideline was mainly the public schools and such. But then we have the caveat in there, or any other educational location. What is building blocks today? Are they a preschool? Are they a daycare? Because the preschool changes it. And if their side entrance is 1,001 feet, and that is a really, really tight measurement. If we're gonna have a side entrance inside that coffee shop, that's gonna move them to less than 1,000 square feet. I mean, 1,000 feet from the school.
Yeah.
So I guess that's the question. What is building blocks?
Well, that was confusing to me at the beginning of this too, Dave. I had told the applicant that they need to have a professional survey done. I was under the assumption that building blocks was a regulated school by our definition. We have the same definition as the state. I called the Office of Marijuana Policy, and they alerted me that didn't meet the definition, building blocks, from state statute. So that's what I'm under the impression of right now from the state. It's something we can look into further with that. I would say having access through the coffee shop to the caregiver retail does change that survey that they did, because they show the survey to the entrance on the other side. So
we can actually, and if that is a concern, we can make that so that there isn't an entrance there. That's the proposed, but we would be happy to do that.
I think I'll be honest. I think rather than 4 months down the road, motivating and you got a business going, and it comes that is a school, it's probably best to, you're already really, I mean, you're within 15 inches of not being able to be there because of that side entrance door. Yeah, I think that would probably be certainly a good move. Now,
That
Rod,
is a,
go ahead, Ruth.
that is a preschool as well as a daycare center.
One of the things that finalized that answer from the state to me was seeing that they received their conditional use license from the state.
What's that? Sorry.
One of the, after following up with the state, Highbrow handed us the conditional use license that they received from the state. The state has the same regulation we do. And actually it's more strict than ours because we do a door-to-door measurement. The state does a property line measurement.
So property line, they must have a smaller foot. They must not use 1,000 feet then.
The state uses 1,000 feet, I believe. Or maybe, or is it? Yeah, I think it's 1,000. They allow towns to go down to, no, they must do 500 because they allow towns to go down to 500.
Right.
But did the state determine they were not a school? Did they make that declaration?
I did follow up. That's what they told me. Yes.
Okay.
All right.
Dave, I had a
Go
question.
ahead, Matt.
So thank you for the application and the detail. It was fantastic, actually. I love getting these binders, like Dave said, and I was a planner in a previous life. So when I look at these things, I try and check the boxes off. And looking at code, I think there was an issue, at least that came to mind with me, and I'm not sure what a difference this would make, but in terms of signage, I think our code says 1 sign per site for a facility like this. And the application materials we received, I counted at least 4 signs, very prominent signs, including one that had a slogan on it, which is also against code, from what I understand, or against ordinance. We're allowed 1 logogram, which is essentially a logo. It's not a slogan. So I guess those are concerns, and I just maybe I'm interpreting the code wrong. Rod, if you want to fill in any gaps if I'm mistaking that. That's just one thing that came to mind instantly for me.
Well, that's a good question, Matt. You're reading that right. That's number 17 on the application. Yeah, that we can check into what logogram versus logo versus sign. I don't know the answer to that.
Logogram's a picture. Very oftentimes it's done in some sort of like a calligraphy of a different language. It's a picture representing wording. So I had the same thing in my notes as Matt, that I think if they use their crow within it, they probably would have been all right. But the wording underneath highbrow says only 1 on-site marijuana sign allowed. We see, like Matt said, there's at least 3 on-site. And then I wouldn't consider the Route 196 Thompson Fair Mall signage as an on-site.
Fair enough. Yep.
Okay.
Sorry, I was on mute.
Right.
So we'll comply with the sign, the sign requirements that the town has. I was trying to look through my packet because now I have 6 pieces of them.
Yeah, typically, and for the Board of Selectmen, this is typical of any planning board review. When a business comes in, the sign ordinance dictates what's allowed, as does, in this case, the license ordinance. So if they're in violation of that, they're in violation of their license. I doubt a business will want to be violating that.
No.
For clarity's sake here, I think you're doing a good job of perhaps getting to a condition that limits exactly what can be put onto that sign that they're allowed for their marijuana business.
Right. Yeah, so we'll definitely comply with the sign requirements that the town has and the licensing has, because obviously we want to be in compliance. That's one of our biggest things that we make sure we do. So I apologize if it's misrepresented in the packet. I think we were just kind of replacing signs that are already there.
No, I mean, it's just, that's what this is all about, though, getting clarification.
Yeah.
Thank you.
We do it right. That's what I had. Those were the questions I had from reviewing the packet and such. Looking around to other board members, any other questions? Seeing, oh, go ahead, Roland.
So can the product that's being bought, the edibles that are being purchased, can they be consumed in the coffee shop?
No.
Okay, just wanted to be on the record.
No.
Thank you for confirming.
You're welcome. No, it's strictly processing. So we're going to be making edibles that we would, and so this would be adult use kitchen, obviously for the caregiver as well, because Charles would be his caregiver business, but then that's, yeah, not allowed.
So as I'm looking at the memo that we're given, page 5, I'm just want to go through with the board here before I read anything off. I'm gonna suggest a condition that the coffee shop and the facility are walled off with no visibility into the access. If everybody's comfortable that that's not a school, we don't need to make that a condition. Though I would say when we create this ordinance and we have a word that says any other school, that's something we have to decide. So, and I know you offered to, you didn't need the door, you'd be fine with it, from coffee shop into the care facility. But I'm just debating whether I would include that as a stipulation. If you've offered it, probably I would. So were there any other conditions? Do we feel we need to put anything with signage, or do we feel comfortable with the planning, or just reiterate maybe a condition that it will meet all town ordinances? You know, not the booklet here doesn't, we're not approving what's in the booklet for signage. Would you like something like that? Go ahead, Ruth.
I have a comment. Truthfully, I think you've done a good job putting your packet together. I think there are some things that were overlooked with the ordinance. I am uncomfortable because I do feel it's a school, and I also, and this is just a personal thing, and I shouldn't do this probably because it's for the town and people voted for this on a referendum by the town, but I really hate to see our business establishments that's already established turn into, that is not a restaurant. I would like to see it somehow stay a restaurant or retail other than marijuana. It's just my comment.
Thank you. Rochelle, I have no idea what my question was about to be. Sorry about that. I had something for you as. I can't remember. All right, so board members, what I added to the conclusion and potential motion on top of the 2 that were provided. Solid wall between the coffee shop and the care facility with no visibility. No entry from the coffee shop into the care facility. And signage will meet all Topsom ordinance, not what was put together in the booklet.
Tell you right now, that sign out front is going to cost a lot of money to fix. I used to go to Ruby Tuesdays quite a bit, and I used to give them a really hard time about why it wasn't lit up. So that might be a good one to eliminate. Just a thought. But Dave, I think you covered it. That works for me.
Is there anything last time go around here? So Ruth, I agree with you. You know, the ordinance says 1,000 feet to a school. And you know, obviously they brought in sight lines and got to 1,001 feet. I spent a lot of time playing with this over the last little bit here, measuring Google Earth. And I mean, they literally could never, ever move their entrance door more than down towards Route 196. They do meet within the 1,000 feet. That they could never, ever put the door in another position more forward. And they would then we'd have to decide of what level that school is. Because if it is a preschool, I would be of the mindset it's a school. And I believe it probably is. But the way they have their building positioned, and if they don't have any entry from that, I don't see how they don't meet. And I understand what you're saying, believe me. But I just so you understand how I'm looking at it too, because I measured it multiple times and I was only getting to, you know, 994 feet. But quite frankly, because it's an entry door, Building Blocks has their entry door probably about 7 feet deep into the building. And otherwise this wouldn't have worked. It's just a miracle of perfect storm working out. A lot of Google Earth. All right. I will, if no one has anything further, I'm going to make a comment. I'm going to make the motion. Seeing nothing. Conclusion and motion. Motion to approve the application of highbrow edibles marijuana business product manufacturing upon the findings of fact as listed in a memo from Town Clerk Linda Dumont dated October 28, 2020 with the following conditions of approval. The applicant / facility may not operate as a state licensed cultivation facility or product manufacturing facility until such time state marijuana license is approved, delivered, and reviewed by the town clerk's office. 2, no changes to this approved license are allowed to occur. The applicant must return to the Board of Selectmen for any license renewals or amendments. 3, a complete wall off from the coffee shop into the care facility with no visibility. 4, no entry into the care facility from the coffee shop. All signage must meet town ordinance. And I'm going to add number 6 because I thought of it as we were going here. The facility may only operate 8 a.m. to 8 p.m. because that was something we talked about. But again, that's something. Do I have a second?
Second.
Got it. Were your motioned and seconded? Patty, this one is on you.
All right. David Douglas, in favor or against?
I'm in favor.
Marie Brilliant.
In favor.
Ruth Lyons.
Against.
Okay. Matt Nixon.
In favor.
And Roland Tufts.
In favor.
Okay, we have 4 in favor, 1 opposed.
Thank you, Patty. Thank you again, Rochelle. Good luck on your guys' venture here. Lots of work still in front of you, I think. So best of luck to you. Thank you very much.
To all of you for your time and for everything you've done.
Thank you.
Have a great night.
Thank you. Folks, don't forget these binders need to go back to planning. We got to turn those in. All right. Here. We are on to 20-90, consideration any appropriate action on guidelines to allow roadside memorials. If you recall, we took this up a while back. I think we finally took it up probably around September, October. And the Orm family came to us asking for roadside memorials in the public right of way. We were given, I shared with all of you an idea of what the family had for what the roadside, their idea of what a roadside memorial would look like. That being, we gained that, and the staff went and researched some information. And if, Mark, were you going, yeah, Mark, were you going to speak to this? Did you want to give any update from the information you sought on our behalf?
Sure, for the benefit of anyone watching, so they know what we shared. We did some research to see what's happening in other places across the country. Some places are expressly allowing private markers. If you do that, there's some concern regarding, you're going to be careful whether you're not endorsing a particular religion, or be careful how you do that. Some places only allow state-sponsored markers, so it would be some type of a generic sign that they allow placed. Some places expressly prohibit markers, which they may or may not enforce it, or they may give a little time before they do. And then many places are taking no official action. The places that are allowing it will sometimes are having permits. Virginia's actually requires the consent of the private landowner that abuts where the roadside memorial would be on public property. Virginia also takes into account the reason why the person, the traffic fatality, why it happened there. They also have a limit on how long it can be there. Alaska similarly has a limit. And then as far as Maine, there is no specific endorsement or prohibition from the state, although that when it was proposed in 2019, one of the comments by state DOT was they said that oftentimes these crashes are at places that are particularly hazardous, which is why the crash happened there. So they had concerns about putting memorials in those in that dangerous locations. Scarborough considered it in 2013 and then ended up deciding to do nothing. And then we were also asked to contact the town attorney to see how this would affect our prohibition on non-commercial signs being put in the public right of way. We basically have a blanket one, except for 4 weeks before the election and 1 week after. And she said that it would be problematic for us to maintain, our limited time frame that signs are allowed if we were now to allow roadside memorials, which are a form of speech outside of that period. So she said it could pose problems for the integrity of that guidelines that we have.
Thank you, Mark. Are there any questions of Mark while he's up? Seeing nothing. So that's what we have before us. Everyone got the picture of what was being proposed. Any thoughts? I will say the driver, the lawyer's opinion is certainly weighs on what I was thinking here. Are there any comments otherwise?
Hey, Mr. Chair, can I have a question?
Yep. Sorry, anyone from the public?
Yes, Brett Stroud asking a question. I never received a depiction of what this was supposed to look like. Is there a way for me to see that?
What there was an idea shared by the family of what it would look like, and I would have to pull it up. And it was an idea, but so nothing's been permanently decided yet. So even in whatever was shared it wouldn't mean anything, I think, at this point, Brett. That's all it was at this point. It was a small cross. I forget in front of me exactly. It might have been 15 inches in height, sort of something like that.
Can I say something?
Michelle, go ahead.
I think the ones that I looked at were between 17 inches and 21 inches tall. And I think we had agreed, my husband and I, on the 17-inch one.
Michelle, are you able to see the screen?
I am.
That's the correct one, right?
Yes, it is.
Okay. So it was in the packet. if anyone sees it online, but this is essentially what it is. And as Michelle had said, that's about 17 inches in height, something similar to that, but it would take the board to make a decision what it would look like. So we've got the feedback, and it's for what we asked. Matt, were you raising your hand? Nope. So we got the feedback. And I will say one of the things that's going to be my driving force, but what happens with these memorials, quite often, the ORMs came in, and I believe fully with the correct intentions, they want to do upkeep. They will make sure this stays right. But when we take on something like this, it's not for one family, right? It's for anyone. And, you know, we have the dedication from the ORM family that they would keep up with it. But that's not going to be from everybody. And when we do this, it does open it to everybody. And quite often, some of these have a lot of things left behind on them. So those are two thoughts in my mind as I'm weighing this: is we don't do this for one, we do it for all, right? So not everyone will have that commitment and that upkeep. And as well, putting this out and changing the way we do signage here in town, it's a large driver.
Dave,
Go ahead, Michelle.
the saddest part about this is you drive around the whole town, and anybody that's placed them anywhere, nobody's ever taken them down. So like if it's on somebody's land, those people are respecting what those people have put there.
Right. Anything on individuals' land, the town has no ability or right or say to go and do anything.
Correct.
We're specifically talking the right of way, and I know you know that.
We're asking for the right of way because a 4-inch cross on the tree was too much for the property owner and he threw it away. So that's why we're trying to move back a little bit and come into the right of way.
Right. Understood. And so we're gonna, this is our first time taking public comments during agenda items. Gonna have to just make sure that we wait, you know, we'll call on people, we'll make sure everyone is, it's not a debate, right? We've got to make a decision. Does anyone have anything to say?
I do. May I make a comment?
Yeah, I said go ahead.
Yeah, the procedure, we cannot make a procedure that people have to follow if they do this, and if they don't keep it up, if they put it in a right of way, a fine or a small fine or something. Can we write something like that attached to it or something like that? So if anybody else, I don't see a lot of people running to do this. I hope they don't have to. So I'm in sympathy with the ORMs, and I just feel that they should be able to do it because it's really tough. And I know the town, we have an obligation to the town and right-of-ways. But if we write a policy or a procedure that has to be adhered to, or can we? I mean, that's my question.
That's my question. I hear what you're saying, Ruth. And a family puts one of these there, right? And they have all the best of intentions, and then it's a birthday or it's an anniversary or something, and friends come and they leave behind a teddy bear, they leave behind balloons or whatever. I've seen 6 packs of beer left behind, right? And that's, you know, are we going to find that family because it was left on theirs? This is a very tough question. Don't get me wrong. There's left and rights at all locations.
I just wonder how many people will be want to put stuff in a right of way. That's all I'll say.
Matt, you were going to speak earlier, or Roland, either one of you.
So yeah, first, I mean, the legal opinion, I think, is not to be ignored. You know, that being said, I absolutely empathize with doing this. If there's a way to do this, I would be more in favor of basically having it be allowed for a set period of time, and then it would have to be renewed. So in effect, you know, if it's being handled appropriately and has not become an eyesight, say, you know, maybe it's a 1-year period to check it out. And, you know, and it's again, under the conditions where it's a right of way. Just so that we have some control on this, you know, if it's approved after the fact. I mean, you're right. You don't want something that's basically forever until, you know, you have to go through and just revoke it, you know, altogether.
When, just for those, so something we'll have to consider. I'm just wondering how, just as people are going, was the group happy with what the Orms presented, size, the look? Do we want to mandate it must be this item and it's supplied by the town and you reimburse the town for the cost of it? So some of that thought too. Do we want to make sure it's uniform at all places?
So set design standards, right?
Right.
Yeah.
I agree with that statement, Dave. I think there should be conformity to a certain thing. And if we adopt this, it could be that, but I don't think we need a lot of stuff out there that's ugly. And this is done in good taste, so.
Mark?
I'd be careful about adopting across. I think we would then get into the issue where we've endorsed a particular, at least, group of religions. You know, if Judaism, or there may be another one that wouldn't necessarily want to cross. So the states that seem to have endorsed a particular marker, it's been like almost like a highway sign. You know, one of the brown signs with some text on it or something.
Matt?
Yeah. Mark, thanks for that. I was going to say that as well. If we start endorsing one religious symbol over everything else, that's definitely not a route I will ever endorse. With that said, when I find myself in confusing situations related to my loss, Michelle, frequently I find my brain is, you know, usually in a meat grinder. Whenever anything comes up related to Noah. So I frequently have to step back and think to myself, okay, what is the logical route here? What can I think Anna from Frozen put it best, Frozen 2, when she said, what's the next right thing? And that really stuck with me ever since watching that movie with my child during quarantine, my daughter. So when I think of this issue, for me, I can't look at it with emotion because I'm far too close to you in terms of loss. I have to look at it through the legal side of things. And I think in this case, you know, Mark has done a pretty good job in terms of looking at what towns have done in the state of Maine alone, but also in other places around the country as well. And I know I wasn't around during the sign discussion or the sign ordinance development, but just from watching folks over the past year reference that particular effort with a lot of disdain in terms of how difficult it was. I don't want to go back and have to revisit that ordinance process that took a lot of time. This would basically just be, I know this would be like amending that process, but there was a lot of thought that went into that. So I guess from my point of view, I have to try and take the emotion out of it because it has controlled my life far too much over the last several years, personally for myself. And I have to represent the folks of the town. And in this case, I think the best situation for us anyway, as a community, would be to listen to our lawyer's advice. Boom. That was a long comment, and I'm sorry about that, but that's where I am.
Don't be. Marie, did you have anything? So I'm with Matt as far as the sign, because the second we do this, Ray's Furnace Repair can put a sign out on the road. Savvy Links puts a help wanted sign out. I do believe these become attractants for not what's envisioned here tonight. You know, a simple marker. But ultimately, the signage issue, and I said it at our earlier meeting, that if we had to open up signage, roadway signage, that would certainly be a deterring, a factor for me. But I will sit back and allow anyone to make a motion that they want before I do or anyone else does.
I don't see I think it deserves a lot more thought. And I do agree with Mark on the cross, even though it would be for me, but you got to be sensitive to everyone. And I do think we have to listen to the lawyer. But I think maybe in time we could come up with a solution, and maybe not tonight, but I don't see why it has to be a sign issue. If it's just a marker or whatever, I don't see why that has to be. But so would somebody explain that to me?
As it's been explained, it's a First Amendment, right? Everyone has their ability. And if we make a rule that limits one set of speech versus others, we are violating the rights of others. Right now, the way we have it set up is for that 5-week period, 6-week period around elections, that during that 6-week period, anyone can put a sign up. It doesn't have to be those that are running for office.
Right.
The furnace repairman can do it and such. But at the end of that, everyone's treated equally. And that's why we did, if you recall, Ruth, when we first did this sign ordinance, before this iteration of it, we simply said only political signs are allowed during this time.
Right.
And we were advised that's a problem because we limited speech, right? So this is why we now have this 5- and 6-week process where it just simply says signage is allowed. So that's why this becomes that issue, is when we allow this, we allow all.
Well, it's a tough issue, and either we have to go back and rethink it and try to come up with solutions, or we've labored it long enough. I don't know. My heart goes out to the Orams, I'll just tell you that. And the emotions out of it, like Matt said, with what the lawyer has cautioned and with what, with the signage and stuff. And we are elected for the people of Topsom, all of them. So if we treat one way, we have to treat them all the same. So having said all that, I just feel a lot of empathy, sadness for them, but we do as a board have to do what's right by the town. But I don't know if it should be a dead issue. That's all I'm trying to say.
I mean, would we not take action? Because as it sits tonight, I'm a no vote, right? Because of that ruling. And I guess it doesn't matter either way. Either we take the vote and it's a no, and it doesn't have to be a dead issue. We can continue to try to find a way around something. You know, Matt, a while ago when we first talked about this, he didn't know if there was an area in town that families, we could have an area where families could do something in memoriam. Though I though, as you know, some of the stuff Mark presented is a lot of this roadside memorial is it's that last location the person was alive, right? That was that, I think it was the Indiana study or whatever it was. It would, you know, it relates to that last location. So we can either table it with no action taken and not, or which is the same. So if you feel better, if people feel better that we want to continue to try to find a way to make this work, tabling it may be one of those things that it keeps it on the mind and the front burner, rather than a no vote. And we, you know, what tends to happen is we move on and forget, right? So Ruth, does that, you know, does that help you?
It does.
Okay. How do I, if we just table this and keep it on the burner? I don't know.
I don't know how we resolve it. No, I have no solutions for that. I could think about it and spend some time on it, but we already have.
What we've been given tonight is, to me, very clear.
Yeah.
And for now, I'm comfortable tabling it personally.
So in an effort to not let this go away, to keep it in the forefront of people's minds, trying to find a way to make something happen, I will make a motion to table this item for further consideration.
I second that.
That makes sense to people. All those in favor of tabling 20-90 for further consideration?
Can I add a friendly amendment real quick?
Yeah.
Just that one of us will, well, I'm actually hoping to reach out to the Orms tomorrow just to keep the conversation going, but just stay in touch in the interim.
Someone
Yeah.
stay in touch.
Yeah,
Yep.
yeah.
Okay. Good idea.
And I'll
So-
work on things too. But
So we were unanimous.
I don't think my friendly amendment needs a second, so we're all good.
No, that's not an amendment. That's a commitment.
It's-
Unanimous, Patty.
550 fucking Little Tanglins. I'm gonna drive by there every day.
Item 20-91, consideration any appropriate action on the Board of Selectmen upon request from Highland Green to determine whether the municipal officers deem Mountain Road substantially complete. Dennis, this is your area of expertise. The pictures look nice, but do you have anything to provide us as far as expertise seeing the road condition and such? You're on mute.
Sorry, thank you. I would say it is substantially complete. It may need revisiting in the spring with some vegetation because of the time of the year, Dave, we're trying to get the grass started with some erosion concerns. But as far as the completion of the road goes, I'd say it's definitely substantially completed and looks good.
Excellent. Mr. Wazalewski, did you, oh. Mr. Wazalewski, do you want to come up? Unmute. Nope.
I don't know. I'm not, John, you there? Okay.
There we go.
Hello?
John. Hi, John.
Hello, you got me?
We got you.
Okay, thank you, thank you. Charlie, thank you for coming in. Just a little technical glitch on my part, but I'm sorry, David, you had asked a question?
No, I just, you know, initially we asked Dennis on his opinion of it because he's the expert when looking at a road, right? I just wanted to give you an opportunity if you wanted to say anything. This was part of the TIF agreement that by the end of December 31st, that the road would be substantially complete. Dennis did say that in his opinion, it is substantially complete. There may be some erosion issues just because of the time of year for growth of the grass and stuff that you guys just may want to look at in the spring, but the road itself is substantially complete. Is there anything you wanted to add to it? I'll get to you, Ruth.
I'm sorry.
Is there anything you wanted to add, John?
Yes, I wanted to thank you for your support in this entire endeavor. And I look forward to an affirmative vote, hopefully tonight by the selectmen, that we are substantially complete. We fully intend to make the $400,000 contribution to the bike path. So that will complete our obligation under the TIF agreement, which will help Highland Green to continue to grow into the future. I did have a few more words after listening to all the guests this evening. And I wanted to sort of bring it full circle for both the selectmen, but also for Ruth and others. So if you just bear with me for maybe 2 or 3 minutes. I wanted to thank you, select women and select men, for having me tonight. I also want to welcome Chris Belanger, who is here and I noticed that Chris has been working as well to help some other businesses in town, which is great. And acknowledge Charlie Katz-Levy, our attorney from Jensen Baird as well, who's on the call. I also want to acknowledge Derek and Mark, and who took over a job in a very hard time. And of course, in a time that it was difficult to follow a hard act in the name of Rich Rodman. I also want to acknowledge, and I look forward to meeting both of them, by the way, because I think the era of COVID has been very difficult to meet people, and I look forward to meeting both Derek and Mark. Sorry, that was my phone going off. Probably my son trying to call me to remind me of the meeting. I also want to acknowledge Dennis Cox, who we've walked the land with and the road with, as well as Rod Melanson, who has worked tirelessly in your planning department to not only follow the entire Highlands and then Highland Green development, but and interpret it and worked with us seamlessly in helping us to navigate the zoning as well as land use issues within the town. All of you have worked very, very hard, and today, especially under the COVID restrictions, which are even more difficult. Ironically, the memorial that you were talking about, I believe, may have been to ultimately honor a person by the name of Mr. Orem. And I believe Skip Orem was a gentleman who helped lead the fundraising drive for the capital campaign for the Mid-Coast American Red Cross, which is at the intersection of course, a Village Drive and Community Way on the Highlands campus. And that American Red Cross building, of course, was built on land that was owned by the Highlands at the time and donated. And of course, Skip successfully raised about $800,000 to build that building for the nonprofit. Also, ironically, you had, and Skip was a wonderful man, if that's the gentleman we were talking about. Also today, you heard very timely messages from Lois Skillings, and we partnered with Mid-Coast Hospital for years in many different ways, but obviously it goes without saying, Mid-Coast Hospital saw fit to build a building right across from the American Red Cross at the same exact intersection, which I think is terrific. So both those places, both those community-wide organizations anchor that intersection known as the Highlands intersection and of course Highland Green. I came to town first in 1989. Ruth remembers me then. Some of the first people I met were Skip Baker, fire chief, as well as Ruth. Skip Baker did not trust the previous developer and one iota. And so I sought Skip to say, look, talk to the other fire chiefs I've dealt with over the years in Saco and Biddeford, South Berwick, Farmington, New Hampshire, many different towns in Maine, and see if I do ultimately what I say. And Skip and I became friends. Ruth as well. I remember Ruth fondly and walking the Highlands campus many, many times, and as well as helping us to navigate in the former Topsom Town Hall, which is now apartments next to Town Hall Village. I worked hard to develop a trusting relationship with the town and am proud of our public and private partnership for over 25 years. And I want to continue that strong relationship and that strong partnership. Since I saw you last year, it's been a very tough 2020. We have had over six COVID deaths in our communities. We continue to own 3 different communities, and it's been an unbelievable experience, not just in the context of the decreased income, loss of life, increased expenses, and sorry to even lump those all in the same category because the loss of life is enough. You get to know people when they move to a retirement community. Some of these people we've known for over 25 years, and they become even more important and larger than family to us during this time. And many of you have been hurt and touched dramatically by this crisis as well. But we've also been lifted by the elevation of the human spirit in countless good deeds that have been created by our fellow citizens. And daily I call, believe it or not, I call an area code 202. I call Senator Collins' office, and I plead with her, and I've been pleading with her since really May, to create a bipartisan program for funding for not only individuals that are in dire need, but also businesses and also state and local governments who are exceedingly going to be hurt by this crisis today and in the future. So please know we are partners with you in that regard. I know you have called numerous times and written letters as well. And I hope you won't give up, because I'm certainly an optimist, and I hope that she will listen and she will use the clout that she campaigned on and use the clout that she now has to create that bipartisanship that will allow this bill to continue. So we believe we've completed Mountain Road. We're very proud of it and very proud of the public-private partnership. And we're ready to make the $400,000 contribution. Small technical matter. We need to take that money from our lender, and our lender requires either an affidavit or a certification from the selectmen that we've met the standards of the TIF agreement, so that those monies will be released. We would hope you would do it now, so that we don't have an end of the year rush, so to speak, and we run up against the deadline at all. So there's a little bit of a chicken or the egg kind of thing in this situation. If you could give us the heads up on that, we hope tonight your affirmative support based on Dennis's recommendation and also Rod's, hopefully that we can move forward. So thanks for putting up with my little speech and maybe a little bit of a history lesson, but it was very interesting listening to not only the 2 new businesses that are coming to town, but also the wonderful timely message from Lois, and of course the memorial, if I'm correct, it's about Skip Oram, who is a decorated veteran and also a fine gentleman who led the fundraising campaign for Midcoast Hospital. Thank you.
I have a question.
Yes.
John, I know the road has been or almost brought up to specs by the time it goes down to town meeting to be accepted. Was there any agreements that you were supposed to make that hasn't been made, or have they all been made?
I think they've all been made. I know they've all been made, Lois. We've really, not Lois, Ruth. We've racked our brain to make sure that it's all complete. We had a miscommunication about the gate. It was mentioned on the plan, and when it was raised by the town, we ultimately, after discussion, we prefer a gate. But at this point, we've said, well, I think it's more important to get the road moving. Work towards town acceptance next year, which I think can follow, given what Dennis has said, and we want to do that to honor our public-private partnership with you.
Thank you, John.
Thank you,
John. So what we have to do tonight is say yay or nay that it's substantially complete. Is that what you need to take to your lender, just that? Or did you need more? You said you were going to look to bring it for acceptance to next year's town meeting. Is that the plan? Because tonight, all we're going to say is it's substantially complete.
Yeah.
We can't say it's an accepted road.
Correct. No, we don't need it to be an accepted road. as part of the, what our lender needs and I would like to have. But basically that it is substantially complete, which honors the wording and the language of the TIF agreement, so that after January 1, December 31 comes and goes, there's no disagreement. I took to heart your wonderful certification last year, which took some latitude to do, that we started construction on December 31. That was a leap of faith, and I appreciate you doing that. We, however, started right after that and moved forward to get it done. We get it done quickly. We just want to make sure it's done quickly and put this all behind us and continue the wonderful relationship we've had with the town over better than 30 years.
Dave, my name is Charlie Katzlevy. I'm John's attorney. May I say one thing?
Sure.
The March 12th, 2018 credit enhancement agreement.
Yep.
It has a paragraph in section 3.6. It provides 3 performance standards that the developer is obligated to meet. The first is to commence construction by December 31st, 2019. The second, to substantially complete the improvements by December 31st of this year. And the third is to make the $400,000 contribution to the bike path. So what we're requesting of the board is to confirm that upon making the $400,000 payment, we will have satisfied the 3 conditions of that agreement. Thank you very much.
Yeah, I just wanted to clarify, because I know, John, you said you're going to try to get this before a town meeting this coming year for acceptance, but we're just tonight saying that it's substantially complete. I just wanted to make sure he had what he needed once we completed that.
Yeah, thank you.
Okay. Are there any other questions going around the room? I've been out, John. I was on it today, and it's a nice road. Go ahead, Roland.
I had no questions. I just, I'm good.
You're ready. You're
Yes.
ready. All right. Once again, it was a nice road, and we look forward to
the sidewalk or the road, Dave?
I was on the road.
The sidewalk's as big as the road.
Oh, it is. We look forward to accepting it in May. I will make a motion that we deem Mountain Road to be substantially complete. I guess that's all I need to say.
Second.
All those in, I'll make it easier on you, Patty. All those in favor of deeming Mountain Road substantially complete? Unanimous. So that will get that portion checked off for you. And then once the last one's done, John, you're good and ready to go.
Okay, thank you, Dave, and thank you, select women and select men.
Thank you.
20-92, consideration and any appropriate action to the appointment to the Finance Committee. And this evening, we interview Tom Sawyer and Kim Talbot. They will make great additions to the committee. The committee has 5 openings. We will, I suspect, add these 2. That leaves, there are still 3 openings out there, folks, to sign up. So I will make a motion that we appoint Tom Sawyer and Kim Talbot to the Finance Committee. Do I have a second?
Second.
Second.
Second. Motioned and seconded. All those in favor? Unanimous. That brings us to the end of our meeting. Matt?
Motion to adjourn.
Second. All in favor?